Madam President, if our health and our survival are closely linked to our biodiversity in Africa, have we created systems for harnessing the value of medicinal plants? And if not, are there efforts right now to get that done? Is there recognition that this is something that is greatly needed?
I think increasingly there are many researchers now, trained researchers in many countries. I think there is the awareness is growing. But I think, as I said again, the awareness may be growing, but we need investment. We need the space. We need these centers of excellence that can do the testing locally. So we need to start putting our hands in our own pocket and create that ecosystem. And again, as I've said, and you rightly said, I've said that many times and I will say it again, biodiversity underpins our life in this planet. And why do we need biodiversity? I think it's very, very simple. You know, we live off the byproduct of nature. And one of the byproducts is oxygen that we breathe. And now if you look at, in fact, yesterday, the United Nations, they have put the Great Barrier Reef as one of the most sites which are endangered. It's true. You can argue, they can bring in the semantic to say, you know, we've done so much and all the rest of it, but the facts on the ground remain. And how many of these sites in Africa, they are run down because we haven't, again, looked at them very seriously. And why, again, do we need to protect biodiversity? Is that this diverse array of life on Earth, you know, underpin our existence because we are the apex species. Right. And one thing is, again, that has been highlighted precisely during the COVID is that, you know, nature doesn't need us. We need nature. When we were in our houses, we couldn't go out. The animals were roaming our cities. We mustn't think that we live outside the ecosystem and we can tame the ecosystem. We are very much part of these species, forming part of this entire chain of life on Earth. And we are no special because we're the apex species. Doesn't mean that we have the arrogance to say that we are special. We're not. We're just one of these species. We are highly interconnected. We are linked. And if you look at, they're now saying in terms of the source of the COVID, if the initial argument that it came from a bat, which has, you know, the virus has jumped into an animal and onto us, it shows that we are indeed very, very vulnerable. So how do we protect our forests? How do we stay away from this source of bacteria, of virus, you name it? We are threatened, but we don't see it that way. We tend to think that we are, you know, we are so arrogant that, you know, we can control anything, but we're not.
Let's jump onto the issue of health security. And you mentioned earlier how traditional medicine is valued in China relative to how we view it on the continent. I think, you know, it will be good to explore that a little bit more. You have said that for every disease known to man, there is a plant that cures it. And across Africa, many of our people are living in rural communities that are mostly poor. There are no hospitals, or they are very far away, no pharmacies that, you know, and had to find pharmacies where they could get conventional medicines, which are quite often unaffordable and beyond reach to them. And clearly, traditional medicine, at least what I see from Zimbabwe, it's not something that we appreciate. In fact, people tend to look down upon it. And yet it could be a solution. And yet a lot of the solutions that we would seek are very much based on those ingredients that we are shunning in our own communities. What could be done to increase the value of traditional medicines within our communities?
You have rightly said that we tend to look down on our own culture and our own resources. I mean, this is the biggest mistake that we can make. Because what happens is that very often the knowledge that we actually have, that is owned most of the time by women, they get taken out and they get really packaged and sold back again to Africa. But my mantra has been that if we start relooking and documenting this knowledge, because every time, you know, we lose an elderly, especially an elderly lady in Africa, we lose a library. And this is something that we have to, well, again, bring this to the leadership of the country, that, we need to start looking at this again. And, interestingly, when you're making the case to the policymakers, scientists, again, here I make my mea culpa, until I came to occupy the position I occupied, is that we tend to speak to ourselves. We don't communicate effectively, and we tend to assume that those leading the country, they will understand. I think this is, again, what we have to do, is relook at our communication strategy and relook at how we actually share this knowledge and share the information with those who are at the helm. But having said this, there is a lot of truth in what these ladies are practicing, because it's a practice at the end of the day. It's traditional medicine practice. And the WHO had dedicated one department to look at this. But I think beyond the WHO, we need to have a department in the Ministry of Health that look at these remedies, because at the end of the day, what we need to do, we need to have a pharmacopoeia, we need to add a scientific framework around this knowledge, so that the dosage can be addressed, the side effect can be addressed, and it can help, a lot of the local health issues can be addressed through the practices that we have. And interestingly, it makes this medicine accepted and acceptable, because it encompasses the tradition, the culture, and what value people bring to that space. So this is what needs to be done. And as I said again and again, by looking at these practices, we are going to promote innovation. We're going to promote an industry. And who says industry creates no job? And then if you have this conversation between the university, the training institution, along with the private sector, you are developing a new pillar precisely to that particular country, addressing health, and of course, creating proper agriculture, because at the end of the day, you have to grow these plants, so you're tackling agriculture. And you can also, if these plants meet the international norm, you can start exporting as well. But again, these are issues that have to be dealt with locally, nationally, and of course, with the local national players, because you still need investment. But what I insist on is the value addition, the transformation has to be done, at least partially, on the continent.
I can see that. And these scientific frameworks that you point out that are needed, I imagine they would create a systematic way of actually clinically testing these products, these plants, to see what value they have to the nation, and of course having legal frameworks to protect all of that, to make sure that when it's exploited, it will benefit the community or the people who are actually contributing this knowledge. And great point you make also, the WHO can only do so much, right, in terms of protecting that. If the people, the custodians of that knowledge, the governments, do not actually recognize or put in place structures to protect it, nothing will change. We will continue to lose this very, very critical resource.
But the thing I'd just like to add quickly is that, the fact that these plants have been used for millennia in some countries, they are already tried and tested. So it's a shortcut to developing something fast, because they have already been in use. And one thing as well that we have to really look at traditional knowledge is that, because we are operating in the space of climate change, these traditional knowledge can help create a third way so that we can use past knowledge to help us adapt. And if we don't document it, if we don't put value to it, we're going to lose it, and to our own risk and peril, to our own detriment.
Yes, and it looks like there's so many benefits to doing this. A simple thing like just documenting what we have and just asking the question, what value does it have to us? We can start to solve so many problems in agriculture, in value addition, in so many areas of our economies. So do you think the COVID pandemic might be the straw that will break the camel's back by awakening Africa to all of these issues that you highlight?
One thing we have to understand is that the COVID is not the first pandemic that the continent has known. And also we must highlight that malaria kills about 500,000 people in the continent every year. And that's not highlighted, right? And yet it's happening. Every year it's happening. Malaria is a big killer. So I think we've had our dose of calamities, health-related calamities, that just gets mentioned only in statistics. This one here is being highlighted for a reason that we know, and it is still a major issue. But we must highlight that Africa has had her dose of these, and I'm sure it's not the last one either. It is one of many that will happen, will come and go. And you've mentioned something about, again, the issue of technology, the issue of what the COVID has revealed. I think one thing that COVID has revealed very, very strongly is how there is such disparity, and it has increased inequality. It has highlighted, it has revealed how unequal the society is. And so again, the takeaway message for our leaders is, do we still need to be in that position if there is a next pandemic which comes along? And there will be.